Hello. Hi, I'm Dr. Brian Koffman. So I'll do just kind of a quick self-introduction. So I'm a family doctor. I'm not a hematologist or oncologist. Doctor turned patient with CLL. I've had CLL for 10 years. And I've been involved in trying to let people know about how rapidly and excitingly the world of CLL is changing, and doing that through a blog and through recently the CLL Society and not-for-profit. So that's kind of my story there. I am one of the other two people in the room that's curled. You don't have to worry about sun exposure with curling. There's a couple just kind of quick, kind of almost throwaway comments that Dr. K said that I just want to emphasize. You notice lack of CT scans that he talked about. When you see a CLL expert, they're not going to be doing CT scans on you. When you see your community hematologist, oncologist, sometimes you have to remind them that there's really no role. There's not no role, there's a very limited role for CT scans. So Dr. K is also the person who was involved in the research on vitamin D, but also on the green tea extract and stuff like that. So looking at kind of thinking outside of the rectangle to try to help us with stuff. So I want to start by thanking the Leukemia and Lymphoma Society and the CLL Research Consortium for this opportunity, and I'm going to try to give some practical advice. So who am I? I'm Brian Koffman. I'm a doctor turned patient, and I beat some pretty long odds. So you just learned about these prognostic factors. So you can see I've got all the bad ones. I'm also CD38 positive, ZAP70 positive. I have some of the newer bad prognostic markers that are bad, like a complex karyotype. So how did I survive, and how am I going to help you survive? I survived by refusing some therapies that were recommended to me, and by carefully choosing the ones that I got. I survived by firing some doctors and hiring the right ones. And I survived by getting insurance to pay for stuff that they didn't want to pay for. So that's what we're going to go through. In a way of a full disclosure, besides being a physician, patient, and cancer survivor, I'm also a professor, retired professor, actually teacher, writer, advocate. That's my blog. I'm the unpaid medical director and founder of the not-for-profit CLL Society. And I've tried to make a little living as a comedian, and I'm a full-time husband, father, grandfather, friend, and a member of a wonderful CLL support group out of Orange County. So could the members of my support group put their hands up here? These are the bunch. Yeah, I couldn't survive without you guys. Thank you. So, being a physician, I think you'll find that I'm one of the most, just make sure you take a look in the mirror there. So, what does it mean being an advocate? So this is a slide from my friend Jan Giesler, who's involved in the CML community, one of our sisters' cancers, and this has been saying nothing about us without us. But I'm going to go further. It's not only about being our own best advocate, it's about how to save our own lives. That's why we're doing this. Okay? So I'm going to start here, and let's see if I can get this to work here. Alright. So, alright, here we go. We're going to go back. Alright, so if you... You're supposed to get up and dance. That's why you just heard about exercise.
Turn up the volume.
Yeah, that's right. I'm loving it. Yeah, all right, there we go. A couple people. All right. So, my goal was always to stay alive. My goal wasn't to be an advocate or a self-advocate, but what I discovered is that in order to live as long as possible, I had to get into advocacy. I had to get into self-advocacy and getting in the community and getting involved. That was the way I was going to survive. So I think every one of us remembers when we get the diagnosis, the big C. So I'm going to go through a little bit of my story and just kind of share my creds in terms of being there. But I think everyone remembers what happened, what that moment was like. So, I think it's, I'm afraid you had a paradigm shift, and I'm going to be revisiting that theme over and over again, because we all have the new normal that we have to deal with when we get the diagnosis. So you're going to recognize some of the people here, and let's see if we can get this to work here. All right. So I wish this was available to me when I was diagnosed. This wasn't available to me. So with the help of friends, a number of whom are here, I've tried to make this available to everyone. in terms of what to do to kind of find out and deal with our CLL. So this is a welcome to the CLL club. Whoops. That wasn't it. That is the CLL. All right, let me try again. Let's try that.
Welcome to the club that no one wanted to join.
That's my
You probably have many worries and questions about your diagnosis.
But you are not alone. The CLL Society is here to help. Before discussing disease management, let's remember 4 things that always come with our diagnosis, besides all the worry.
The first one is time. CLL rarely requires immediate treatment.
We almost always have time to get smart about our disease or find someone who is.
Number 2, help and information. We will share the honest facts, from the basics to the latest research and important clinical trials.
3, changes in CLL management.
The very best choice today is likely to be upstaged by more promising options tomorrow.
Number 4, changes in ourselves. Cancer is a huge challenge, but some things can get better after diagnosis.
Your priorities shift. Our lives can become more full of gratitude and purpose.
We may never have wanted to join this club.
But it can be a safe and nurturing place.
Stay in touch.
Stay strong.
We are all in this together.
So I'm very grateful to my friends and the wonderful thing about the CLL community that's out there now is there's different things. There's, the website that we have, but Leukemia Lymphoma Society has wonderful stuff. The CRC is sponsoring this meeting, Lymphoma Research Foundation. There's a number of wonderful organizations out there that can give you the information. There's online, and I'm going to go through how to access some of that a little bit later, because I think that's critical for our survival. So this is the enemy. Keep your friends close and your enemies closer. So I was diagnosed on a routine blood test. I remember saying, oh, my cholesterol was pretty good, but what are all these white blood cells, I had enlarged nodes. I thought it was a cyst, and then they did the what's called the flow cytometry, and that's how I was diagnosed. So my lymph nodes grew pretty quickly. That's not uncommon with 11q deletion. I grew this big beard. So when I was seeing my patients, they were saying, what's wrong with you, Dr. Koffman? What's all that lumpiness? But the beard, the Santa Claus beard, didn't really work. The nose got bigger and bigger. And then one day I was on call for my group. I was on call and I had blood work done, and they said, Dr. Koffman, we have a critical lab result on Dr. Koffman. My platelets were single digit, and I ended up in hospital, and that began multiple hospitalizations, and Dr. Kipps was able to help me out with that, and my local hematologist, oncologist helped me out. I'm going to go over putting your team together, multiple hospitalizations. I ended up having an emergency splenectomy. I bled, and it lost half my blood volume. That led me very quickly to a first remission transplant, because my autoimmune problems with low platelets were very hard to control. This is a picture my son drew of me. If you look carefully in the top corner, you can see I'm getting 5 different IVs at a time. Transplants are not for wimps. Mine didn't work. This is what I looked like immediately post-transplant. What do you think? But within 6 months, I'd relapsed. My CLL was back. Didn't need immediate treatment. My platelet problems were back in less than a year. So here was now, I developed a 17p deletion. Soon after this, you can look at things were not looking good. I was like this big 18-wheeler rolling down the road, heading for a crash. Once you look at the data, and one thing I got to say when you look at data, and the data that Dr. K presents, that Dr. Kipps presents, it's all looking backwards. The data looking forward is better. Whatever treatment you get today, like we said in that video, it's going to be better tomorrow. The data is always better today than it was yesterday, and it will always be better tomorrow. Treatments are always better. But the data look pretty awful for me. So time for another paradigm shift. You can't drive around in first gear. You have to shift your paradigm. So for me, that went to going to Columbus, Ohio, because at that time, if you ask around and you talk to the CLL experts, you will find wherever you go, there's a difference of opinion about what to do. I mean, I think there's some consensus, but there's nuanced differences in how they approach the disease. but there was a consensus building that, hey, there's some new exciting treatments that are out there. And for me, that option at that time was a drug that was then called PCI 32765, that later became ibrutinib, that later became Imbruvica. And that wasn't available to me anywhere in California. So I ended up moving to Ohio, leaving beautiful Southern California in the winter and moving to Columbus, Ohio for 3 months to get on this drug. This is me, and I'm very grateful to Dr. Bird and Jeff Jones and the team at OSU for helping me out. And I say, ask your doctor if taking a pill to solve all your problems is right for you. I wish it was true. And so the other part of this is, and Dr. Kipps addressed this, is I'm doing fabulously. I'm in a very deep remission. If you look at my absolute lymphocyte count, it's 1. If you look at my lymphocytes, less than 1% of those lymphocytes are CLL cells. If you look under the microscope, I have 8 cancer cells in every microliter of blood. That's like nothing. But I'm on third base. I'm not home. If you do the math, that's like over 50 million cells in my body, in my bloodstream, that are cancerous. Just one of them has to evolve, and the whole game starts again. So don't leave us stranded. So that's what I'm so grateful for Dr. Kipp in putting this consortium together. Because our goal, yes, it's wonderful to be controlled, but we're going for a cure. So let's talk a little bit about the self-advocacy part here. So here's the job description, and if you just read all the things we're supposed to do, you get tired just looking at all the things that we're supposed to do. So why in the world would you want to take this on? You know, I've already feeling the burden of the disease. Now I've got to be my own advocate. Can't I just outsource this? And you know, so I'm going to talk about why it's important and why it's important to be knowledgeable about it. And the reason is, the bottom line is that we do better in therapy if we're our advocate. We're the ones with skin in the game. We're the ones who do better. But there are times, clearly, if you heard Terry speak last night, there are times that we're just too sick, we're too tired, we're overwhelmed. I think it's absolutely fine to outsource this to a spouse, to a partner, to a child, to a parent, to someone else, depending, and have somebody else handle this for you if times you just can't handle it out. But plan that and think about who that advocate is going to be for yourself. And there are these contradictory messages we get. We say, it's our life at risk, we're the ones with the biggest stake, ultimately we have to make our own decisions, but we all need support. Cancer is a team game, and so there's these conflicting points of view, and we have to put them together in a way that's meaningful. So what is cancer self-advocacy? The Institute of Medicine says it refers to being assertive. Assertive doesn't mean being obnoxious. Okay? So here's sort of guidelines: be direct, be brief, be to the point, present your facts. So we need to have knowledge of ourselves. We need to ultimately know what resources we have, what challenges we have, what things scared us, what kind of help do we have at home, what kind of help do we have in our community, what kind of support system do we have. But ultimately we need to know what's our own bottom line, what's most important to us in terms of treatment. Some of us want it aggressively treated, others want to say, I don't want to have anything to do with this. Some of us want to bury our head in the sand. I don't think that's the group that's here. We also have to know about stuff beyond ourselves. So please, we have to know what the options are. And guarantee whatever options are today, they're going to be entirely different in 90 days from now. It's changing that fast. So you have to know what your health team's strengths are. Not all of us have access locally to a CLL expert. So what expertise do we have locally to try to help us? Let's take a look here at, so I'm going to talk about this, and this is stolen from John Cabot's Zinn, but I'm going to talk about 3 steps to survival, which are prepare, act, and be aware. So these are my steps based on John Cabot Zinn's work on mindfulness. So the first thing I want to say, the first thing is to put your team together. And this applies for all disease states. And you can pick up on your way out. Please stop at our booth. You can pick up. We have a spreadsheet like this. You can go to our website and download this. But please take a look at this. So you need a world expert. You need a Neil Kay. You need a Tom Kipps. You need a Bill Werdig. You need a world expert to head up your team. But these guys are busy. They're on the road a lot. They're giving lectures in San Diego, and their patients are, in Minnesota. So what's going on? So you need a local expert who plays well with others, who's willing to listen. You need the world expert and a local expert, and those two people have to communicate and play well together, and that's not always going to be the case. You need an interpreter or a recorder to go into the room with you. I'm going to go over that in detail. You need a support network, and that's family and friends to help out. You need kind of a virtual support group. So the next step after putting your team together, and this is part of that same thing, is to find or become an expert. And this is Dr. K's study out of Mayo Clinic, and Sheila talked about this yesterday. But there's a survival advantage and a progression-free survival advantage to seeing a CLL expert. That patients live longer if you have a CLL expert on your team. So I can't emphasize that. And it's not a small number. It's like a 25% overall survival advantage in looking at these numbers. If you don't find an expert, then you got to become an expert yourself. And I'm giving you some resources here. We have links to everyone else. So we're kind of trying to if there's a great article that's written somewhere else, we're just going to link you to it and stuff like that. There's a Leukemia Lymphoma Society, and I've also given some survival toolbox kinds of stuff. And you go to the website, you're going to find all of this stuff. So the next part of this is to think laterally, and I think, Dr. Terry Hamlin was mentioned, who's one of, I think, many of our mentors in terms of trying to help us deal with CLL, talked about thinking laterally, and it's because people the doctors in this room are thinking laterally that we have some of the new alternative therapies that are out there, and absolutely question authority. Use your own inner voice. If it doesn't make sense to you, then ask about it. Get a second opinion. So let me go on to that. So I'm going to talk about, now we're going to move on to acting, and acting globally. This is really an important issue. It's a time issue. And we talked in that video, you have time with CLL, but you don't have forever. Windows of opportunity open and close. Now this is less of an issue than it was before. So what can happen is that, I always say you want to delay therapy until a week before you need it, because you don't want to rush into treatment before you need it, because there's been no evidence that there's any survival advantage to early treatment. But you don't want to wait until you're too sick to get treatment, because a lot of the treatments will damage your bone marrow and cause other problems. Now that's a little less of an issue with some of the new novel therapies that we have, because they're easier to take if you're already going in with low platelets or low hemoglobin. They don't seem to cause the damage and the increased risk of infections and other low blood counts, but it's still an issue that's there. But generally, like I've already said, the future is better than the past and better than the present. So the longer you can wait, generally, the better. There are clear criteria for when you should be treated and when you shouldn't. So, talk to someone who's a CLL expert, understand what those criteria are. The trend is your friend, Shia Venkat on CLL Topics. Who's seen CLL Topics in that website? It's a really good website to take a look at. Shia had a spreadsheet. We've updated it there for you. You can download it. Your doctors appreciate seeing that. The trend is your friend. See what's going on there. Risk is impossible to eliminate. There are no blank inserts, package inserts. The package inserts none of them say, this drug causes no side effects. This drug is safe to take with everything. They all have pages and pages of legal and medical aid written in there. So there's always going to be risk. I can't emphasize this third point enough. You're going to have to make decisions with imperfect knowledge. That's what trials are about. That's what these new therapies are about. How long is the longest person who's ever been on Imbruvica been? 4.5 years, maybe 5 years? We just don't know at this point. We just don't know what's going to happen down the line. So you're going to get imperfect knowledge, and I can guarantee you're going to get contradictory advice. And again, I'm going to emphasize, I'm alive because of clinical trial. You get the best care in clinical trial. If it makes sense for you, it doesn't make sense for everybody. And Sheila went over some of that stuff last night, but it's worth really taking a good look at a clinical trial. All right. So now we're talking about acting locally at the doctor's visit, okay? Bring a member of your support team with you and bring a tape recorder. Doctors do not mind tape recorders in the room, and if they do mind, get a different doctor. They don't mind that. I can't tell you the number of times I left Dr. Kipp's office and my wife went on and said, well, it's good that he said that, and my wife was saying, no, I thought he said this, you know, and so again, let's look at the notes, let's listen to the tape. So, I mean, it's really critically important that you do that. Set an agenda. Dr. Kipp would love to be able to spend an hour with each patient, but he can't. So make sure you ask your most important question first, not as he's hanging on the door walking out, okay? Bring all your results, but try to avoid data overload. The doctor doesn't really need to know what your blood count was 22 years ago. It might be. And here's my ifs, okay? If you don't understand, get it clarified. There are no dumb questions. The doctor would much prefer that you ask and get the clarification. If you don't agree, say so. Don't just harbor it and say, well, I'm never going to do that. Let the doctor know it's all about shared decision making. That's so critical. If you want a second opinion, ask for it. No doctor is going to say no to that. We're very thick-skinned. We don't mind. We much prefer our patients get a second opinion. We're very thick-skinned. So let's deal with some quick things about what to do in terms of when you're at the doctor's office. These are some practical questions. How successful is this therapy? Tell me about the side effects. Tell me about the long-term side effects. You know, a lot of times, does this increase my risk of secondary cancers? Does this cause problems with fertility down the line? Does this cause other issues? Make sure your doctor understands what other health issues you have. You have kidney disease, you have diabetes, you have other issues. What changes in lifestyle can I expect from this? Is this something that you do routinely? Am I the second person you've ever seen with this? Like I say, there's 17,000 new CLL patients. There's about 17,000 hematologists, oncologists in the U.S. That means the average one sees one CLL patient a year, one new CLL patient a year. Do you want a doctor who sees one of your disease new a year? That's why you want to see a CLL expert. Okay, ask if this therapy, certain therapies will prevent you from getting other therapies down the line. So that's an important thing to think about. Ask about what self-care you have, and ask to make sure you understand what the insurance and finances are going to be, because just because it's a clinical trial doesn't mean that everything's going to be covered. Just a couple things on insurance. I'm no insurance expert here, but when you have a problem with an insurance and everything goes well, then there's no issue. But when you call saying this isn't covered, like the day before I left, I got this huge bill. I'm a member of an HMO and I get this huge bill that shouldn't be there. So what do? You have to gather your facts. You have to set the agenda for the phone call that you're going to make. You have to set limits in front about that. They're willing to negotiate with you. Set limits in front. Try to set up a win-win situation. Try not to get angry. Try to be patient. Set aside a lot of time to be on hold. This is my only advice with insurance company. The last section I'm going to deal with here is kind of being aware. And my one big tip in terms of being aware is to underreact. You're going to get good news, underreact to it. You're going to get bad news, underreact to it. It's going to be up and down. And if you can avoid this and make it like this, you're going to do better. Expect the unexpected. Remember to live now. Be thankful. Remember, we're all in this together. So connect with others. Help others. Data has shown that people that are involved in doing charitable work, that are involved in advocacy, live longer than people who don't. It also shows that people who play golf live longer. So thanks to all the patients, especially the brave volunteers from clinical trials, CRC and LLS, and let's cure cancer. Thanks very much.